Hi, everyone. Uh, we are a little bit late, 11 minutes late, but nurses here from Healthcare Heroes and Game Changers. We're actually entrepreneurs, so we're coming in live from our business page, but we are here. We formed together what we call is a tribe because as just being entrepreneur or as just nurses, we sometimes needed someone, right, to be in a group, to be accountable for the successes and the failure we are faced with life. But overall, as nurses, life is great. But we are here for you today to celebrate with you Breast Cancer Awareness Month, October. So my name is Pinky Carpizo. I am here in California. I hail from the Philippines, and we are here for you just to give you a good chat, a good pep talk, and hopefully share with you the breast cancer awareness for this month and what this is an amazing story with one of our business partner and one of our co-nurses, Elizabeth Nabire. I want to pass it on to Iwa to introduce herself as well.
Hello, everybody. My name is Eva, and I am a nurse by profession. I spent about 10 years working in OR. Right now, I am a stay-home mom, raising my four kids, and I live on skirts of Chicago. Yeah, so that's all about me. How Let's move to Dana.
Oh, hi everyone. How's everybody? I'm glad that I'm part of this podcast today. I'm so very thankful. Anyway, I'm Donna here, nurse Donna from BC, Canada. I'm actually at work today, so just trying to get in this few minutes. Maybe I'll be able to give some 2 cents of my of this breast awareness thing. And I am a mom as well, and yeah, I've been here in Canada since 1991. Started my nursing in 1994. Thank you. And Evangeline, maybe you can introduce yourself.
Uh, Hi everyone. This is Evangeline. Career. I'm also a nurse entrepreneur. Um, I'm still working in the hospital, but I'm doing part time here, so I'm trying to put more time on my business since I enjoy it a lot. And so I'm here in Florida. I'm from Florida, United States. I've been here since 1996, and the same year I started my nursing career here. And so far, so good. But I need a backup plan for my future, so that's why I enjoy, you know, my online business. So anyway, that's all for me right now. I want to introduce you our main guest, Elizabeth, who will share us the journey of being a survivor of breast cancer, and she will share us a lot of good information, treatment, what she's going through. Okay, here you go, Elizabeth. Um, Elizabeth.
Just a little delay.
Oh, she'll be late. Oh, okay.
It's the connection, I think.
Yeah.
Hello there.
Oh, okay.
My name is Elizabeth Nabire.
Oh, hold on 1 second. Sometimes the connection do get lost, but she's
Hmm.
gonna come back. She is actually, hold on 1 second. That happens to me a lot when I do the road to success, but she's coming in. Anyway, so she is as you know, she is one of our cancer survivor, and she's also my business partner. Yes,
Amazing.
yes. Thanks,
Sorry,
Elizabeth.
sorry, I'm having poor reception back. Yeah, sorry for that.
Don't
My
be,
name is
that's
Elizabeth
okay.
Nabire. Oh, I'm an immigrant from Kenya. I live and work in USA. I live in Columbia, Missouri. I'm a registered nurse, and I'm also surviving breast cancer. Thank you for giving me this opportunity today to talk to you guys and the public. Thank you so much.
Awesome. So, Elizabeth, we want to ask you a couple questions. There are, a lot of people out there who are going through very similar things. A lot of people with breast cancers out there, and they might need to hear your story for, their inspiration and just to have, I don't know, just a little um, like acknowledgement that there are people who are in the same shoe. So we want to ask you a couple questions. When were you diagnosed exactly? Like how long has it been?
Oh, I came from Kenya in 2020 to chase the American dream. And then when I was only 9 months old, that was in 2021, the month of September, I had gone to visit my physician, and then she sent me to do the screening. And then she told me, "Oh, at your age right now, you need to be screened for cancer." So I screened for everything. I had prepared for colonoscopy, which I never did, and then I went in for my mammogram. And before then, I had never felt any lumps within myself. I used to do my breast exams. She also had to examine me before I went in for the mammogram. So when I went in for mammogram, they called me and they told me, "Hey, seems like your right breast has an issues. You need to come back to be rescanned." So I went back. It was a very painful procedure. And then the same day they did an ultrasound. Then they told me, "Hey, you seem to have a mass in your right breast, and most likely it's cancerous." I was not even imagining of cancer. I was like confused because I was like, "Where is it coming from? I've not even felt anything."
Right.
But I only felt the pain during the mammogram procedure. Yeah.
So I guess you
So
just
then after
answered.
that, I had to go in for biopsy.
Yeah.
So then I had to there to prepare me for several biopsies, which I went through. Very painful procedures. I did MRIs, and they came up with a diagnosis of stage 1 breast cancer.
So I guess that answers my question. So your reaction when you found out your diagnosis, you must be, like you said, you were shocked, right? Because you don't know where it came from.
Yeah, I was wondering where it came from. It was devastating. In fact, I just thought of my children. I'm like, I'm very far away from home. I was just seeing death, and then I was like, I'm not going to work for some time. I don't know how I'm going to. I'm not how I'm going to survive. I didn't know the mode of treatment which I was going to get, and cancer can really drain someone. I was like, I'm gonna stay at home, and I'm the breadwinner who's gonna provide for us. It was a lot. Yeah.
Wow, that is amazing. Amazing. So she's very close to my heart for the reason that I know her story from the very beginning. So here we go. I want to, congratulate her because I want to tell the world that Elizabeth went to treatment and now she is in remission, right, Elizabeth?
Awesome.
Yeah.
Wow.
Congratulations.
Congrats.
Thank you. Thank you so much. So I went in for surgery initially when I went to see my oncologist. They had to do several tests, and then I went in for my surgery. Initially they said I had one lump, but after several MRIs and biopsies, it showed like I had like 5 different spots on my right breast. So they told me, "No, right now you cannot just remove a lump because you lose most of your breast tissue. What we need to do, you'll have to lose your whole breast." It was really devastating just to lose a breast. Now, I was to make a choice between losing one or losing both of them. So then they advised me, "Oh, you know what? Maybe it may come later." And then I just decided to go for both. I did a reconstructive mastectomy, whereby they removed both of my breasts because I didn't want to go through the same stress that I went through when I got my first diagnosis. So I had to choose for double mastectomy, reconstructive mastectomy.
Right.
And then when I yeah, they did. They put some of my lymph nodes on the right side, and lucky enough, it cannot spread to the lymph node. So they told me, "Hey, you are lucky. We'll not do radiology, radiation. I mean, we'll not do chemo. We just manage you with the tamoxifen. That is a pill that it
You'll be
tries
with
to
it.
control the well, yeah, to block
You'll be
the
with it
estrogen level.
forever,
Also,
right?
estrogen is very high. Yeah,
Oh,
so that's what I'm taking. I've been told I'll take it for 5 years, but I'm doing fine.
oh, that's
Yeah,
great.
That
Yeah.
awesome.
is great.
So, so are you still doing any other treatments? And how are you doing with your treatments right now? Are
I
they?
only take a pill every day that is oxygen.
Oh,
So no more surgery,
I
no
never,
other treatment. You're done.
I,
Just
done?
I never did chemotherapy because when they tested my lymph nodes, the cancer was not spread to the lymph nodes, so I was okay. I never did radiation. I never needed it, so I was just told I'll do the tamoxifen, the pill to raise the estrogen level. So that's what
right,
I'm taking. And from January 2022 up to now, I take it every day, once a day.
right.
Wow.
Okay.
That is
Yes.
something. That is something that you would say, uh, for you to go through that. It's really true that cancer is something that you just go through in a chapter in life, and it's not the whole story of your life. So it can be overcome, right?
Yes.
Wow.
Yeah.
Yeah. So
Triumph.
triumph,
Triumph. Yeah.
triumph,
Yeah. Overcome.
overcomer all the time. But
Yeah.
Yeah.
anyways, so we're doing this breast cancer awareness, right? Every one of us are nurses, because at the same time we also want you to know why the whole world is doing October breast cancer awareness, and we have each of us to share you why, why the awareness. Of course, we're doing the awareness because it's just we want to promote to people out there that early detection, because Elizabeth is very lucky that it didn't go to the lymph. So if
Yeah.
it went to the lymph nodes, that's where you circulate. The blood circulates too. So you have to do self-exam and mammography. And I'll pass it on to Donna. Which one else is breast? Why are we doing
Yeah.
breast awareness?
Sure. I think that we should be involved in raising funds for the research and treatment. I think it goes a long way. If 10 years ago we are not, we have advanced. So, and because of these funds coming from, from different costs supporting this research, right? So
Yes,
let's get involved.
yes. And anything, Iwa, you feel, why are we doing cancer awareness? And what is the whole thing about this all over?
I think you know what, just talking from the experience being in OR, and actually I was part of the plastic team where we had a lot of cases with women who went through the breast cancer, and we did a lot of mastectomies and a lot of implants put it in for women. So I think one of the reasons why we're doing the
Sorry. As you know, we are in the mercy of technology. So Iwa, we lost her
time
volume, but there
before
you
the
go.
cancer spreads out. And if so often, if you detect it and you know how to detect it early enough, it's curable. It's highly curable. So
Yes.
so that's a big reason, I think.
Yeah. Danji,
That's for sure.
please share with us your thoughts, why you think, as as nurses, we advocate for all these things, though, and not only nurses. Why are we doing breast cancer awareness?
We're doing this breast cancer awareness. In fact, I'm acted on that too. Since I'm doing the Zumba or the workouts, dance workouts. So we're doing hello. We're doing like yearly we call it Pinsang Baton because it gives awareness to the public about the early detection, and also as nurses, we're supposed to be we are advocating and give more information because we're on hand there, and we're taking care of these patients who have been through also with the uh, actual have problem with breast cancer, or we have early diagnosis of cancer, so we can you know relate to them the big picture of information, what's going on when you go through with this breast cancer treatment, and the impact with your personal life, with the family, and how can we avoid and early treat something. I got echo, sorry.
That's okay.
I don't know what happened.
That's fine. That's a mercy of technology, but that's nice that you're very involved in that, as element of us. Elizabeth, do you have any parting words just to tell the world that breast cancer is a stigma and it is curable, and how you're a living proof of that? And how would you just address the public about breast cancer? Anything that you want to
Yes, yeah.
share?
Yeah, yes, breast cancer is a stigma. I remember when I was diagnosed, I didn't want many people, even other friends, to know that I was suffering from breast cancer. When I went in for my surgery, I was like, "Hey, I just did a back surgery." But later on, I was like, "Hey, I just need them to know. Maybe I'll help people. Those who are like keeping to themselves. They don't talk about their health." So that's when I went to public and said and told them, "Hey, I've been diagnosed with breast cancer." So I just want to encourage the public, especially the ladies. If you're in your 30s, just make
Yeah.
sure you go for your normal screening, do the mammograms. Don't wait to feel the lumps. You may miss to feel the lumps. I never felt the lump, but through mammogram, I was diagnosed of breast cancer when it was still in very early stages. Just make sure you eat healthy. Make sure you do exercise. And the ladies who are doing the family planning methods, especially on hormonal, you also have to be very careful. You have to be very keen with the screening. So it's a journey anyway, but when it's detected early enough, it's curable. It's curable. Don't wait till maybe you're 50 years or how many years old that you're diagnosed. When you just feel a lump, just see your doctor immediately, go for the screening. Yeah, don't wait when it's too far. And some of the ladies, when you feel the lump, is like it's already in the third stage. Don't wait for that time. Do your screening early enough.
Yes.
Mm-hmm.
Last
Agree.
word, Eva, and then we're gonna part.
No, I just want to, I'm really
Yeah.
grateful for Elizabeth to joining us because, I think the message will get to those people who are, in similar situation. And it's easier to believe somebody who went through it already, and just, bring that awareness that, as she said, the early detection is so important for everybody. Like, even us as nurses, we can teach so much to other people how to monitor it, how to, feel, and how to, like, self monitor yourself, when you
Yeah.
taking shower, or in different situations. But just be aware of it. If, as she said, if there is something that you feel it, go ahead and check it out. I myself had I had like a little lump that I felt before, and it was a couple of years ago when I went to the doctor and I did the mammogram, and it turned out to be a hormonal changes. So there was nothing really there, but the self detection is so important, that you do for yourself, because uh, you know that's our first step in prevention.
Okay, we'll hear from Donna. The last words for this chat. Thank you for joining us, Donna, and you'll hear more from her from now on.
Yeah, thank you so much. And yeah, let's just get be involved again about the breast cancer awareness. Like what Eva said, we have to, be what you call this, aware of ourselves. Actually, I don't know if we have enough time here, but in BC, in Canada, if I reach age 40, you can go for mammogram without the doctor's order.
Oh,
So yeah, you don't need to have a lump or anything like that. You just book yourself for mammogram, and you're good to go. As long as you reach 40, I guess 40, life begins at 40, right? So yeah, well, thank you, Elizabeth, for joining us. Really inspiration. I am awe to what you've
True.
been from. Your journey from being home, my immigrant to a new country, and then went through that at this, and then you went to the treatment, obviously surgery, what I mean, and then the adjustment period. You are champion, like
champion.
honestly. You and I hear your story, it's a triumph in my mind. You're successful, and now a digital business owner with
Yes.
this group of people,
Thank
nurses, not
you.
just, yeah, not just nurses, but all of us here. It's a very the community is not comparable to other businesses out there, like honestly. And I, not because I am a business owner too, I mean online with you guys, but it does, right? I felt the connection, the support of the community in this business. Thank you.
Yes. So we'll have Evangeline Vanji to say our last parting words for us, and we'll see her again Saturday. Please, Vanji, address.
Okay. Thank you, everyone, and thank you, Elizabeth, for your valuable, time and information you shared to us today. It's so nice to hear from nurses like you that's been through with this journey, because
Yeah,
sometimes it's kind of different if you just see the patient, it's just patient, but when you
right.
from the nurses, like, oh wow,
Yeah.
that's it's kind of something that kind of hit you there,
Yeah.
in heart, because we're always taking care of people.
Yes. So
Anyway, so and thank you for Donna,
Thank you.
first for Pinky for sharing us
Your
um
platform, yes.
your
yeah,
your,
we'll,
your
we'll be
platform.
here. We'll be here.
All
Yes, we are
right.
actually, this platform is nurses, but the healthcare heroes and game changers, that's game changers that are other field of profession, moms and anybody, because as we said, we are each other supporting group. Our community is, this is sponsored by iBusiness, and we are here to support each other. Everyone's journey is different, and but we are just here to support each other. You never know who's out there who's listening to you, and you never know who's out there who just needed a little bit of encouragement for the day, a little bit of something to listen and say, what are these people doing again? But we'll see you every
Yeah.
Saturday, and be kind. You know, life is different in your point of view. Life is different in other
Yeah.
people's point of view. Stay
That's
kind.
Stay
yeah.
kind. Thank you. Yeah.
Yes.
All right.
Till next
Thank
time, Elizabeth,
thank
we are so
you.
grateful that you shared your journey, and we'll see you again next Saturday, Elizabeth. She's
True.
gonna work
Stay kind.
tonight. Tonight.
Right.
You are indeed a survivor, and I am so blessed to be your
Yeah.
Yes.
business partner.
Amazing.
Thank you for your
Amazing.
trust. God bless
Yes.
everybody.
God bless.
Okay,
Till
take
Bless
care.
next
you.
time. Thank you for tuning
Thank you
in,
so
everybody.
much.
Thank you.
Bye.
Thank you. Bye bye.
Bye. Thank you, guys.
Bye bye.
Next
Bye.
time again.